Hello everybody, my name is Hassan Nafid. I am an anatomy and physiology instructor at Madison College in Wisconsin. We will continue talking about our anatomy and physiology sessions. This time we're going to talk about body directions, body planes, and body positions. These are terms that are frequently used in anatomy and in the health care to communicate, to describe, and to analyze health and disease situations. In our human body, we can identify 4 planes, and these are imaginary lines that we assume are dividing our body into sections. These sections will enable us to describe and to analyze some phenomena. If you take a look at this model, the human body here, I'm going to use this plane, which is dividing the body into 2 equal halves, as you see, right and left. And if I turn it this way, you're going to find out this is a gray board here. This is known as the Mid Sagittal Plane, and it divides the body into 2 equal halves, exactly right and left. Mid Sagittal Plane. The yellow board here, if I turn it this way, you're going to find out it divides the body into 2 parts, front and back, or what we call anterior and posterior. This is known as the coronal section or coronal plane. And if I turn it this way, or I have to pick it up a little bit to show you this plane here, which is the blue board here. This one is dividing the body into just 2 sections. Doesn't matter. And this is known as the transverse plane. And the transverse plane is a section that divides the body into 2 parts at any level. It is also known as cross-sectional plane. These planes are used for the most part, in radiology, as in MRI, or in CT scan, to make slices of our human body to find out about any pathological diseases at any level or any lesions. Also, I want to talk about body locations. And body locations, I'm going to use this, and maybe I refer to that one too sometimes, this human model, to show you these locations. And these are in the front. This position we call, or this location we call frontal or ventral or anterior, because it is located in the front of the body. On the other hand, if I turn it this way, you're going to find out there is another location here, and that is in the back of the body, and we can refer to this one as posterior or dorsal, or the back of the body. Just likewise here, this location in the back of the body, we can call it dorsal or posterior or the back. Also here, a location that is away from the midline towards one of the sides, either right or left. If this is the midline here, Let's imagine there is a midline. Any position that is, or location that is away from the midline, we call it lateral. And any position that is towards the midline, we call it medial. So lateral, medial. A position that is towards the head, let's use this one now here. A position towards the head, we call it cephalic. And a position that is towards the floor or in the back of the body, towards the floor, we call it caudal. Actually, caudal is better used in animals because they walk on 4 feet or 4 legs, and it's better described that way. But it's interchangeably used in human with superior, which towards the ceiling, and inferior, which is towards the floor. So we have inferior, which towards the floor, and we have superior, which is towards the ceiling. So we have superior and inferior. We have proximal and we have distal, and these are used relatively to anatomical landmark. Like what? Anatomical landmark are areas in our bodies or locations or spots that are of anatomical importance. Like what? Like the nipple, like the belly button, or the eyes, the nose. Any position can act as anatomical position, and that's where the terms proximal and distal can be easily applicable or applied to. For example, if I talk about the knee with reference to the belly button, I can say the knee is distal to the belly button. But if I talked about the belly button with reference to the knee, I could say the belly button is proximal to the knee. So this is a relatively term that is used to describe locations that are away from anatomical landmark towards the floor, which we call distal, or a position or a location that is towards the ceiling or towards the top of the body and is away from that anatomical landmark, and which we call proximal. Likewise, we can say, let me use this one here. Sorry. Could say, for example, the transverse column, which is here, is distal to the apex of the heart. Or I can say the apex of the lung is proximal to the diaphragm, which is up. Also, I can say the transverse column is inferior to the stomach. Or I can say the right lobe of the liver is superior to the colon. So these terms have some form of flexibility to describe anatomical locations or anatomical terms. Another one is anatomical positions. And when we talk about anatomical positions, this is the position our body assumes in the space. For example, we have 3 positions. We have standing position, like this, which is an erect position, and in the stand anatomical position, the person assumes a standing position with the palms, which are pointed to the front, and the thumbs are lateral. So standing, palms facing front, and the thumbs facing lateral. This is known as the anatomical position. Anatomical position is the position that upon which all description of any anatomical, clinical description is based on. For example, if a doctor requested anterior position or anterior posterior AP X-ray, that it means the person has to face the X-ray machine to the front. So that's how it is based on. Another position is a sitting position, and the third position is lying position. And the lying position could be 2 or 3 types. 2 are normal, one we call supine position, in which the person is laying down with the face facing upwards, and he is or she is laying on her back like this. Let me show you. So this would be a prone, a supine position, head facing up, and the person is laying in the back. Another position is a prone position, and this is just the opposite of that, in which the person is laying on his face, facing downwards, and laying on his tummy or his abdomen. Another position was used sometimes called coronal position, in which the person is assumed a lateral position and to one side. Another position, actually it's the fourth one, and now 3, is the lateral position, laying lateral position. And this is a position that sometimes assumes to perform some form of examinations and to relax body ligaments, or it is as required by the doctor. So again, to summarize, I'm going to go over quick these positions, and the best way to study these positions is to compare, because that way you have a system of learning it. So we have superior, which is towards the top of the body, and we have inferior, which is towards the feet, towards the floor. We have lateral, which is away from the midline, and we have medial, which towards the midline. We have anterior, or ventral, or frontal, and then we have posterior, which is in the back, or it is also known as dorsal. We have cephalic towards the head, or we have caudal, which is lower towards the lower back. We also have distal, which is related to anatomical position away from the midline, and we have proximal, which is towards the head or towards the upper part of the body away from a particular landmark. Another position that is sometimes used is superficial and deep. And superficial simply means towards the upper or the upper layer of the skin, and deep is deeper to the skin. Thank you for watching this video, and I will see you next time in one of our sessions. Thanks.